Many physicians wonder, how often should I test my patients? Although there is no single solution when it comes to testing protocols, there are guidelines that providers use to create better urine drug testing protocols and medication management. Let's look at the common types of patients and see how often they are typically tested. Mental health patients. Because many prescriptions have dangerous interactions with other drugs, current SAMHSA guidelines recommend testing all mental health patients a minimum of 8 times per year. After establishing a 3 to 6 month baseline, if the patient is compliant, quarterly testing may be enough to continue to provide quality care and proper treatment documentation. Non-compliant patients continue to be tested every visit until they demonstrate compliance. Senior citizens. Seniors are normally considered low risk and might be tested only once or twice per year. However, establishing a baseline on these patients is also extremely important. As you are aware, seniors are at risk for prescription diversion, which necessitates testing for compliance, whether the diversion is intentional or the patient is being exploited by others. To save money, many seniors are turning to online pharmacies, which are unreliable and frequently sell counterfeit prescription drugs with potentially lethal side effects. Regular testing will help you know that prescriptions are being used by the patient as prescribed. Once you have a baseline, these low-risk patients are typically tested semi-annually, and non-compliant patients are tested every visit until they demonstrate compliance. Patients with chronic pain. As you are aware, treating patients with chronic pain is difficult because it is both time-consuming and fraught with legal concerns. New CMS guidelines recommend testing every patient to establish a baseline. After baseline testing, most providers test these high-risk patients every time that a refill is requested to ensure proper use and compliance, and to avoid a potentially lethal mix of illicit drugs and prescribed medications. Pregnant patients. ACOG recommends that physicians require a baseline test for every pregnant patient to ensure that the patient is not abusing drugs or prescription medications. If the patient tests positive, the provider can then take measures to ensure that the baby is delivered in a facility equipped for high-risk pregnancies. Furthermore, the provider now has data to safeguard the practice from a lawsuit if there are any complications during pregnancy or delivery. Following these protocols offers the benefits of medication management as well as audit protection for the practice. Regular testing will help you know that the prescriptions are being used by the patient as prescribed. Practices that follow written testing protocols typically avoid costly lawsuits. And even more importantly, patients benefit when providers have more complete data to make medication recommendations. So, how does Beechtree Diagnostics help providers ensure better patient care and add an additional layer of audit protection? Beechtree Diagnostics designed their test reports to save providers time, with audit proofing in mind. We support our clients by testing in accordance with the individual practice's established protocols. Beechtree reports make medication management at a glance easy for the provider and their staff. Our simple red-green reporting makes it easy to see if the patient is compliant with their current treatment plan. Historical data on the past 5 test reports are printed on the front page for quick, easy comparison. If you use another lab to get this information, you would have to print test reports from the last 5 visits to compare the reports side by side to see that patient's medication analytics. How many providers have time to do that? A graphical representation of the current and most recent 25 test results are also printed on the front page, so you can easily see medication trends. No other labs offer this type of trend analytics. Beechtree is the first lab to provide useful data for medication management. Beechtree even offers an optional sign-off in each section of the report if you want to demonstrate evidence that a staff member reviewed the results with a patient, to ensure protocol compliance and to document medical necessity as part of your treatment protocols. For a full list of testing guidelines and resources, visit our website at btdlab.com.